Hey, are you trying to avoid knee replacement surgery? Let's discuss new treatment that can help address knee pain, avoid knee replacement, and get you active again. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrative Medical, and I want to talk about knees. Your knees. Before we get started though, please consider sharing this video with your friends and family, even if it's not relevant to you right now, because I promise you, one of them is considering knee replacement and really struggling. And while sometimes it's unavoidable, many times there are ways around that kind of a surgery. It's a pretty big surgery. And that's what we're talking about right here, right now. The frustration of wanting to be active, to lose weight and exercise more. Yet, you're not able to because of knee pain. And this frustration cannot be overstated. It's a catch-22 and a downward cycle that so many of us experience. We know we need to move to be healthy, but our knees won't allow any meaningful activity. Patients start avoiding activities that they love. And that's called fear avoidance. And we start avoiding things and backing away because we're afraid that it's going to cause more pain. And even if the activity is something that feeds our soul, pain will make us back away from it, because pain is a heck of a motivator for the good as well as for the bad. Fear avoidance leads to deconditioning, muscle atrophy, and weakness if it's prolonged. If it takes a long time, if it goes over a long period of time. This leads to being sedentary, and research is very clear. A sedentary lifestyle leads to depression, anxiety, sleepless nights, and inactivity. And those things all lead to deepened and prolonged, more profound, pronounced, chronic pain, deepened chronic pain, and ultimately can lead to a shortened lifespan. So as you can see, knee pain all by itself can impact patients' lives profoundly for the negative. So treating knee pain, let's talk a little bit about that. When knee pain plagues us, we have a handful of choices, really. There's exercise or physical therapy. There's low-level laser is very useful for knees. Cortisone injections, hyaluronic acid injections. Some people do stem cell injections, which is still in its infancy. There's platelet-rich plasma injections, and there's surgery. So our first knee-jerk reaction, pretty punny, right? Our first knee-jerk reaction to knee pain is to do an orthopedic exam to try to determine what's going on here with this patient and this knee. One of the most common reasons for knee pain is one that few people have even heard of. It's called pes anserine and can be treated fairly easily through exercise and low-level laser. We see pes anserine all the time here in our clinic. So some knee pain can be addressed fairly easily, fairly straightforward, and typically quickly. Many times, though, there is no easy fix, and so we keep on going down through the list. When patients come in, we ask, what treatment have they already done prior to showing up here in our clinic? And for knee pain, the most common answers are physical therapy and cortisone shots. Well, let's talk about cortisone injections. Although cortisone joint injections are the most common treatments, they present some issues. The first one being that cortisone injections can be detrimental to the integrity of the structures in the joint, the cartilage, and the bones. The cortisone can degrade the bone and cartilage to an extent. And while it's good for inflammation, cortisone shots can cause more long-term issues. And that's why the physicians will typically only perform maybe 3 injections of cortisone per joint. The second reason is cortisone isn't typically helpful from our experience. And if it is helpful, it's only a short-term effect, and it doesn't typically last very long. It treats the inflammation, but does not treat the cause of the inflammation. So the inflammation returns eventually, which requires more cortisone, which can further damage the joint. And that's just not a cycle that I want me or my family or my patients to be a part of. Now, a better option for knee joint pain, is platelet-rich plasma or PRP therapy. According to the HSS education site, platelet-rich plasma or PRP therapy uses injections of a concentration of a patient's own platelets to accelerate the healing of injured tendons, ligaments, muscles, and joints. In this way, PRP injections use each individual patient's own healing system to improve musculoskeletal problems. PRP injections are prepared by taking anywhere from 1 to a few tubes of the patient's blood and running it through a special centrifuge, which we have here at Creekstone, in order to concentrate the platelets. And these activated platelets are then injected directly into your injured or diseased body tissue, which releases growth factors that stimulate and increase the number of reparative cells your body produces. Pretty cool, right? WebMD says, a healthcare professional will collect a small amount of your blood. They'll place your blood into the centrifuge, like we talked about, spinning it down at different speeds until it separates into the different layers. And then one layer is the platelet-rich plasma, and this layer of plasma may have as much as 3 times more platelets than regular blood. The platelet-rich plasma will then be injected into the affected or the complaint area. And that's when the healing starts. Once platelets are in the area that's being treated, they break down and release growth factors, which are compounds that help cells repair and renew. And this is thought to trigger your body's healing process. It's just amazing stuff. So some common treatments for PRP include general overall osteoarthritis pain. Man, how many people have general osteoarthritis pain that PRP could help? Here's one you probably didn't expect. Hair regrowth. That's right. People are using PRP to regrow hair. You can expect reasonably to get the same hairline that you had 5 years ago from PRP therapy. Pretty cool. And then knee pain, of course, that's what we're here for. WebMD said, quote, some studies have found that platelet-rich plasma injections significantly reduce pain compared to placebos. People's physical function also improved significantly, and these benefits continued at 3, 6, and 12-month follow-ups. That's a year later. PRP is also excellent for shoulder pain, hip pain, carpal tunnel syndrome, plantar fasciitis. We see a lot of that. TMJ pain. That's your jaw, right? Tennis or golfer's elbow, lots of people have those issues. Ankle pain and elbow pain and a whole lot more, like back and neck pain even. You can use PRP on those. So WebMD said, quote, PRP injections are used to treat torn tendons, tendinitis, muscle injuries, arthritis-related pain, and joint injuries. They're becoming more and more common for cosmetic procedures as well. For example, dermatologists and hair replacement experts are using PRP injections to treat, like we had talked about, hair loss, the hair loss called androgenic alopecia, which is also known as male or female pattern baldness, which affects men and women. So PRP is a great option for that stuff. I am including links in this the online blog. If you go to creekstonecare.com, you go to the blog and you go to the knee replacement blog, you're going to find a whole list of randomized controlled trials demonstrating how PRP beats cortisone and hyaluronic acid and is not detrimental to the joint. It's an easy answer to knee pain and to avoiding knee replacement surgery. Using your own body to heal your own body. Yeah, that's what we're all about. The best thing about it is that there's basically zero chance of an allergic or an immune reaction to PRP treatment, since the treatment is from the patient's own blood. And not only that, but any side effects or complications are exceedingly rare. It's important to note, though, that I'm not claiming PRP is a silver bullet, but I am telling you that according to the research and the experts performing the research, it sure shows effectiveness. Not only a little bit of effectiveness, but significantly effective in most of the research papers. And we would love to help you with your issues. Pain is what we do here, and we get excellent results through a multimodal, broad management approach, which includes medical services like PRP, chiropractic, acupuncture, IV therapy, weight loss, just primary care, staying on top of your health, massage, all kinds of stuff, all here under one roof. Creekstone Integrated Medical is truly Amarillo's only one-stop healthcare choice for everything short of surgery for musculoskeletal issues. So if you're from the Texas Panhandle or you're going to be passing through, call us at 806-355-3000 and let's get you set up on our schedule so we can get you back into your life, feeling better and doing more. If you're watching us on Facebook or YouTube, subscribe, comment, like, and share. That does a business like ours a world of good. Until next time, stay safe, stay smart, and we'll see you then.